Welcome to my channel Medicine Guide. What is ketamine? Ketamine is an anesthetic used to put you to sleep for surgery and to prevent pain and discomfort. Ketamine for depression and anxiety is currently being researched, using lower doses. Ketamine is also a drug of abuse that is used illegally recreationally for its hallucinogenic properties and is known to be a date rape drug as it causes short-term memory loss. When used for anesthesia, ketamine is given as an intravenous injection, IV, or as an intramuscular injection, IM. Ketamine is an NMDA receptor antagonist. Ketamine became an FDA-approved medicine on February 19, 1970, as a general anesthetic to be used as the sole anesthetic agent for diagnostic and surgical procedures that do not require skeletal muscle relaxation. It is also used for the induction of anesthesia prior to the administration of other general anesthetic agents and as a supplement to other anesthetic agents. In this video we will discuss some unique traits of this drug, so let's start our discussion. But before that, please subscribe to my channel Medicine Guide. Is ketamine a controlled substance? Yes. In the US, ketamine is a controlled substance classified as a Schedule III drug under the DEA Controlled Substances Act. This means that ketamine has a potential for abuse that is less than the drugs in Schedules I and II. Abuse of the ketamine may lead to a moderate to low potential for physical dependence but high psychological dependence. Drugs that are classified as Schedule III are currently accepted for medical use in treatment in the U.S. Why is ketamine abused? Ketamine is abused illegally due to its dissociative properties. Dissociative drugs can lead to distortion of sights, colors, sounds, self, and one's environment. It is often snorted, up the nose, injected, mixed into drinks, or smoked with marijuana or tobacco. Other dissociative drugs include phencyclidine, PCP, salvia divinorum, and dextromethorphan, DXM. Hallucinogens include LSD, psilocybin, and mescaline. Abuse of large doses of this medicine can also lead to powerful visual hallucinations that are intensified by environmental stimuli. Coma and deep unconsciousness can occur. When higher doses of ketamine are abused or during emergence, it is reported to produce vivid dreams and an out-of-body, K-hole, or near-death, hallucinogenic experience, often reported as terrifying, similar to a bad LSD trip. Abuse of ketamine can be linked with short-term and long-term problems. Short-term. Problems with attention, learning, and memory. Dreamlike states, hallucinations. Sedation, confusion, loss of memory, raised blood pressure, unconsciousness, dangerously slowed breathing. Long-term. Ulcers and pain in the bladder. Kidney problems, stomach pain, depression, poor memory. There is also the risk of HIV, hepatitis, and other infectious diseases from shared needles. Ketamine use can be fatal in people who are alcoholics or acutely intoxicated with alcohol. There are animal reports of an increased risk of toxicity when ketamine is combined with caffeine. Theoretically, this may be a concern in people who have consumed energy drinks, often done at nightclubs where this medicine may be abused. Who should not use ketamine? Ketamine should not be used in patients for whom a significant elevation of blood pressure would constitute a serious hazard, or in patients with known hypersensitivity to ketamine or to any excipient. Warnings. Emergence reactions. Tell your caregivers if you have hallucinations or unusual thoughts while waking up from anesthesia. Hemodynamic instability. Temporary increases in blood pressure, heart rate, and cardiac index may be observed during administration. Vital signs and cardiac function should be monitored during administration. Risk of respiratory depression may occur with overdosage or too rapid a rate of administration. Maintain adequate oxygenation and ventilation. Risks of using ketamine alone for procedures of the pharynx, larynx, or bronchial tree. Pharyngeal and laryngeal reflexes are not suppressed with ketamine when it is used alone. Avoid use as a sole anesthetic agent in surgery or diagnostic procedures of the pharynx, larynx, or bronchial tree. Muscle relaxants may be required. Pediatric neurotoxicity. Studies conducted in young animals and children suggest repeated or prolonged use of general anesthetic or sedation drugs in children younger than 3 years may have negative effects on their developing brains. Discuss with parents and caregivers the benefits, risks, timing, and duration of surgery or procedures requiring anesthetic and sedation drugs. Drug-induced liver injury is associated with the administration of this medicine. Increase in cerebrospinal fluid pressure. An increase in intracranial pressure has been reported following the administration of this medicine. Patients with elevated intracranial pressure should be in a monitored setting with frequent neurologic assessments. Before taking this medicine, you should not be treated with ketamine if you are allergic to it or if you have untreated or uncontrolled hypertension, high blood pressure. Tell your doctor if you have ever had heart disease, high blood pressure, liver disease, alcoholism, or if you drink large amounts of alcohol. Disclaimer. Channel's intention to make this video is for informational purposes only. Consult your doctor or healthcare provider for use of any medicine or for query of any disease. Thank you for watching the video. Please do not forget to like, share and subscribe to my channel Medicine Guide. Up next, side effects and pregnancy, lactation considerations of ketamine.